ARU-1801 is a lentiviral gene therapy for patients with severe sickle cell disease. And as your audience knows, there are many investigational products right now, gene therapies and gene editing products for severe sickle cell disease. What makes ARU-1801 different is that this product is able to engraft with markedly less conditioning chemotherapy than all the other regimens. So as your audience knows, all stem cell-based therapies, gene editing and gene therapy therapies for sickle cell disease require a genetic modification of a patient's own stem cells, and we give those stem cells back to the patient. But to do that, you need to create space in the patient's bone marrow for those genetically modified stem cells to take, and that's through conditioning chemotherapy. Now, the unique features of ARU-1801 allow our product to be administered with markedly less chemotherapy. So we use a reduced intensity conditioning regimen called of Melphalan, 140 milligrams per meter squared. All of the other programs under investigation right now use fully myoablative Busulfan therapy. And the differences between Busulfan and reduced intensity conditioning Melphalan are marked. So markedly shorter windows of neutropenia and thrombocytopenia, no risk of veno-occlusive liver disease. And hospital stays are markedly shorter for patients who get Melphalan 140. So we're looking at 1 to 2 week hospital stays compared to 6 to 8 week hospital stays with myoablative Busulfan. And in some adults, reduced intensity conditioning regimens can be given in the outpatient setting. So huge difference in terms of toxicity profile for patients, providers, and payers. And so ultimately, what I hope is that there's many gene therapy and gene editing compounds available for sickle cell patients off in the future. They'll have their choice. But how are physicians going to make their decision? They're going to make their decision based on really only 3 things: long-term efficacy, long-term safety, and short-term toxicities. And that's really where this product can differentiate.